Good morning and thank you for joining in. Montana National Guard has played a critical role in responding to COVID-19 since the start of this pandemic here in Montana. National Guard members have provided support services for testing events in communities across our state and in our tribal communities. They were stationed at our airports and train depots to test passengers for symptoms as they arrived in Montana during the summer months. They assisted with the delivery of personal protective equipment to schools all across our state. To this day, they provide support in our state labs, such as compiling testing kits and assist reservations with contact tracing efforts, food distribution, and transport. National Guard members have also stepped up at times when staffing has fallen short from outbreaks at congregate care facilities, such as at the Canyon Creek Memory Care in Billings back in July, and a Marias Care Center in Shelby early on in April. Montana National Guard is again stepping up to provide much needed staffing support at the Montana State Prison for the next 2 weeks. The group of 67 soldiers have now started their duties, which are aimed at ensuring the operational aspects of the prison can continue. National Guard soldiers will be screened before each shift, will wear appropriate personal protective equipment, and their direct contact with inmates will be minimal. This support for the Montana State Prison is absolutely critical in ensuring the clinical staff can focus on caring for those tested positive for COVID-19 in the facility and on mitigating the spread as much as possible. As soldiers of the Montana Army National Guard's General Support Aviation Battalion just returned home from overseas this past weekend, and as additional Army National Guard members begin their services to our state at our state prison, we're reminded of the many ways our civilian soldiers and airmen protect our citizens. The Guard has served with a purpose here at home throughout our response to this virus, and I know that all Montanans are certainly grateful for their duty and commitment during these challenging and unprecedented times. In addition to congregate care facilities or settings such as the prison and nursing homes and assisted living facilities, schools across Montana continue to navigate through COVID-19. Schools are providing in-person learning as much as possible and remote learning to ensure that kids can still receive the education necessary for their futures while responding to positive cases when they do occur. Since schools opened their doors, we've seen nearly 1,200 cases reported, and that was through October 16th. We always knew that we would see positive cases in our schools, yet importantly, schools are acting quickly and taking mitigation steps to curb the spread. As you'll see in our weekly reporting, most schools where cases are reported have been able to keep the numbers low and get the virus and spread under control. And at the same time, then also many of the schools that once had the virus are now cleared and back to normal. Our schools certainly do need the support in ensuring that they have the resources that will help them make the best decisions possible and create the best learning environment possible. That's why when we were gearing up for back to school, we made CARES Act funding available to every school district in the state. Interestingly, the Treasury Department, just about a couple of weeks ago, issued updated guidance that provided that states could actually use CARES Act money to help schools reopen. And I think that was done soon after it was made clear that there's little chance that Congress passes another relief package before the election. We certainly didn't wait for that Treasury guidance and got funding to our schools as they are preparing to reopen. And recently, we reached out to the school districts in our state who received funding from the original distribution of coronavirus relief funds, asking if they needed additional funds that could help assist them through December 30th, 2020. We currently have available unspent funds of about $5.5 million from transportation funding provided for school budgets. We want to make sure that these unspent funds go to schools should they need further resources over the next couple of months to continue with the safety measures that provide the best learning environments for students. We know the need for our schools will remain well beyond December 30th, yet unfortunately that's the deadline that all CARES Act dollars must be spent by. We'll be carefully reviewing requests to meet additional needs and ensuring that our schools have what they need to stay safe through the end of this calendar year. Through the 32 relief programs established to support schools, businesses, nonprofits, and individuals utilizing the coronavirus relief funds, we continue to get money out to where it's needed most and work to ensure that the funds are indeed spent by the December 30th deadline set by Congress. We recently analyzed the distribution of CARES Act dollars by other states where data was publicly available. Of about the nearly 40 states that actually publicly share their allocation and distribution, Montana currently ranks 9th for the percentage of our CARES Act distribution actually out the door and spent. And let me be clear, this is from information that we could find and isn't a complete picture. We're one of the very few states with a publicly available dashboard where you can see where dollars are being spent. Of Montana's $1.25 billion, 97% has been committed, over 60%. Same time making sure that all 56 counties in Montana, businesses, nonprofits, schools, and individuals have an equal opportunity to receive funding. Montanans can see where we've committed dollars and how much of that has already been spent under the Resources tab at covidrelief.mt.gov. COVID-19 cases are now on the rise in 47 states. Here in Montana, we continue to see an alarming increase in daily positive cases. This virus has already brought death to over 300 Montanans. As we know, there's a delay in incubation periods, which means we're only going to see our hospitals continue to be stretched. It's clear that this virus will continue on this path unless we all work together to stop it. And how we stop it is by taking the simple precautions that our healthcare workers are asking of us and making sure that our friends, our family, and our neighbors are doing the same. Avoiding large gatherings, washing your hands and disinfecting, stay home when sick and call in a provider to get a test, wear a face covering in public places. local healthcare provider, and it's actually free in most situations. In addition to the DPHHS Masking Up campaign, they'll also soon be launching a flu shot awareness PSA campaign to encourage Montanans to get the vaccination, particularly with COVID-19 still in our midst. With that, I'll turn it over to Stacy Anderson, who's the lead communicable disease epidemiologist, Jim Murphy, who's the communicable disease and laboratory service division administrator, and Greg Holtzman, who's our state medical officer. Stacy.
Good morning, everyone. I'm here today to give you an update on the COVID numbers that we're seeing in the past several weeks. As of this morning, Montana's closing in on reporting close to 30,000 cases total since March when COVID arrived here. Over 4,000 cases were reported just last week, and that's a 17% increase from the previous week. If you look at it this way, 4,000 new cases is almost as many as the number of people who reside in Glendive, Montana. 10 counties in Montana reported more than 100 cases each last week. In the past 3 weeks, we've added almost 13,000 cases. This is almost the population of Bighorn County. We've had over 1,200 hospitalizations in Montana to date. This is greater than the population of Whitehall, Montana. We've surpassed 300 deaths statewide. This is more than the population of St. Regis, Montana. These are all Montanans. They're all part of our community who've been affected. We continue to see increases in schools, long-term care facilities, and other congregate settings across the state. Because of that, I wanted to take a little bit of time to talk about the holidays, because they're coming. We're headed into the holiday season. We're not going to take your holidays away, but what we want to try to do is encourage folks to be diligent and to do these things safely so that we can still continue to celebrate the holidays with our loved ones. Specifically, we've been talking, you just heard Governor Bullock talk about prevention measures that we need to prevent the spread of COVID-19, but I'm going to say them again. We want to make sure that you're wearing a face covering. You want to make sure you wash your hands frequently. Sanitize frequently touched surfaces often. Stay home if you're sick. And as the governor said, these things can also protect you against other respiratory illnesses that circulate during these same winter months, like influenza. And so I also urge you to get your flu shot. So let's talk a little bit about Halloween. Halloween is coming very soon. All of us like to see the little ones out in their costumes, and we all like our chocolate too and candies. But keep in mind, first and foremost, if you're sick, please stay home. If you've been told that you're a contact to a COVID case and you're in quarantine, please stay home. These things will keep the people, other folks in our communities safe. Try to get creative. Obviously, we don't want to have large Halloween parties with a lot of folks. Try to get creative, have smaller groups, have movie nights, have a Zoom costume parade or costume contest. Try to think outside of the box for other activities that you can do to celebrate the holiday and still have fun while still keeping you and your loved ones safe. In terms of specific Halloween things, make sure that if you're out trick-or-treating or you're wearing a costume, make sure that you have a face covering. Try to incorporate a mask into your costume. But we really don't recommend that you wear a mask underneath a costume mask. That could make it a little difficult to breathe, obviously. A costume mask, though, is not a substitute for a cloth mask. And obviously, kiddos younger than 2 are not recommended to wear masks. This is all guidance that you can find at the CDC's website. If you're trick-or-treating, try to go in small groups. Try to stay with your family group, people that you already know you are with all the time and your close contacts. Try to maintain that 6 feet of distance between yourself and other groups who are out trick-or-treating. For example, if you see that someone is already at the door of a house, wait until they're finished before you approach the house to trick-or-treat with your kids. Keep your interactions brief. It's a good idea to keep some sanitizer with you in case you need to kind of quickly disinfect between houses. And when you get home, encourage your kids and yourselves to wash your hands thoroughly before you dig into those goodies. Now, if you're on the other side and you're providing treats for trick-or-treaters, obviously we want to minimize the amount of contact that you have with people coming to your door. Make sure you wear a mask. Make sure that you wash your hands before giving out treats. It actually is recommended that if you can find a way to separately bag up treats and put them out so that kids can grab them, that's a safer way to distribute them. Make sure, like I said, that you try to maintain that distance between yourself and people approaching your door. So in general, those are sort of the recommendations that CDC has for having a safe and happy Halloween. There are several other things on that same CDC website that kind of classifies various popular activities at Halloween into low, moderate, and high risk levels. So if you're interested in that, please take a look. And with that, I'm going to turn this over to Jim Murphy.
Good morning. So last Thursday, the governor announced the availability of a website allowing individuals to submit concerns regarding compliance of business establishments with state and local public health measures to slow the spread of COVID. This is not a new website. It's actually been in existence for over a decade for the general public to submit concerns about licensed establishments in Montana. We basically just took advantage of that existing website and added COVID-19 to it. Since that announcement last week, over 1,300 concerns have been submitted to the website. Of these, about 1,000 expressed concerns regarding mask use, social distancing, and cleaning and disinfection issues related to COVID-19. About 90% of the concerns came from the state's largest counties, which are also the counties with the most cases. However, about 40 counties at least had one issue submitted regarding business in their location. The remaining 300 comments didn't have anything to do with public health. They were just people testing out the website or commenting on some of the other aspects about COVID. What was encouraging after reviewing these was that there wasn't one comment that we received that was attacking a business or overly negative about the business. Most of the comments were very constructive, and they were basically expressing concern about their own health, health of the customers, health of the workers, and their own coworkers. It was encouraging to see that level of concern expressed. When a concern is submitted, what we do with it is we review it, and then we forward it to the local health departments. We send that to the lead sanitarian and what we call the lead public health official for their review. They'll determine at the local level whether or not there's anything actionable or anything that needs to be followed up on. That's going to be a local determination that is made. We will also review trends at the state level and be able to provide assistance to the locals, should they need it. Some of that assistance might be interpretation of the directives, for instance. In most cases at the local level, what we expect is really they'll do some outreach and do some education to the business owners about the directives that are in place and the reason for those directives. Most businesses want to do the right thing to protect their workers and their customers, and we're confident that they understand that that's in everyone's best interest. Many of our COVID clusters in Montana are directly related to workplaces. These are clusters among coworkers, but we've also had some customers that become cases as well. Following the directives is going to be essential to help minimize further transmission in these settings, especially as our numbers increase in Montana. Again, this effort is necessary and it's important to identify health concerns that place other people at risk. Most of the things that are identified can be easily addressed. Given our current number of cases in the approaching influenza season and the stress already on hospitals, we need to do everything we can to kind of curb these numbers. and kind of get the numbers to come back down the way that we would like to see them. It's going to be important to do that now, and everybody can do their part to help slow the spread of COVID. Thank you. I'll turn it over to Greg Holster.
Thank you. So for the last few months, we've been talking about controlling this virus, learning to live with COVID-19, and ways to protect yourself and your family, from one group to another, because we all interact. 20s to 50-year-olds, these are the people that are working in so many of the areas, especially with vulnerable populations, in nursing homes, at the hospitals, in the prison, and so many other places around the state. We've talked about this before, but even if a skilled nursing facility is doing everything right to protect their residents, if the virus is quite prevalent, there's a lot of virus in the community, there's a high likelihood that that virus will get into these congregate settings. This is made more challenging because we know this virus can be spread by asymptomatic or pre-symptomatic individuals. These are individuals that have the virus, can spread the virus, but aren't having any symptoms. They don't know they have the disease yet, thus keeping the virus out of a nursing home or assisted living setting so much more difficult. This also occurs for other congregate settings too, prisons, group homes, even our schools. So just because you're young, it's also to remember it doesn't mean that they will do well when they get the virus. Overall, most do, and that's very encouraging. For many people, it's a mild to moderate illness. But what do we do about the young adult who has a chronic disease? One of the other things you'll often hear is, well, the individuals need to protect themselves, and we don't talk about it from a community perspective. Well, how about the young individual has type 1 diabetes or lupus? How do they stay safe within the community response? Sure, they can make sure they don't go to high-risk areas, large congregated areas, they don't go to bars or concert, but how about their job? How about their schooling? How about taking care of family members that need their help? These are all things that need to happen, and if we can keep the virus down in the community, we can allow people to continue to work and continue to move forward with their lives with some minor changes on how we do that, such as wearing masks, washing hands, social distancing, etc. To add to all this, and we stated this a little bit before, who are the vulnerable? We have a lot of useful data out there to talk about risk. People that would, if they got the virus, their risk of having a poorer outcome is greater than this other group. But there are people with underlying diseases that do fine with this virus. And we've had a child who has not done well. Luckily, overall, has recovered, but we've had cases of multiple inflammatory system disease in a child, and that has happened in other places around the country. So it's not a one-size-fits-all or that we can predict the future. We can just look at the data and make some determinations of what happened in the past. To bring me to our second point of why this is a community disease, we have a limited amount of resources that are out there. I think this was pretty prevalent in the spring when we were challenged with personal protective equipment and testing supplies. Currently, we're doing pretty well in these categories, but no source is unlimited. But we have other concerns going on right now: hospital capacity and human capital. When there's a lot of disease in the community members are likely to get ill or need to be quarantined. This is true for our healthcare providers who live in those communities as well. This can lead to staffing shortages, which can even decrease some of the medical centers' capacity even further. Our EMS system is strained. With increased cases, we are having challenges with EMS transportation of patients, and we are in the early part of the cold and flu season. Medical costs is another issue that we've been talking about a little bit. You can talk to individuals who have ended up getting this virus and had a poorer outcome and have spent many long time in the hospital or maybe even on a ventilator. But we also talk about community cost. If you talk to some of our hospital CEOs, you will hear about how challenging it is for them to get traveling nurses, which are in great need, to come to their facilities if they can find them. Because not only is other states looking for these individuals, but the cost to pay for these individuals has gone up extravagantly. Lastly, no one wants to hurt an innocent bystander. However, if we let the virus spread widely in our communities, some individuals will pay the ultimate price with their health and possibly even their life. We have over 225,000 COVID-related deaths in the United States and 300 here in Montana. Every death might not have been entirely preventable, but we know we could do much better. Just looking at other industrialized nations and how they have responded, they have not stopped the spread of the virus from spreading. They have not prevented all deaths, but they have done much better at minimizing suffering and deaths within their community. And to quote a document from the Oxford Martin School from a September 1st article, there's no signs of a health economic trade-off, actually quite the opposite. If we all work together, we can get this virus under better control. We can have in-person learning in our schools and our universities. We can have businesses open. We can decrease the strain on our healthcare system, our public health system, and all the healthcare workers who care for you and your family, whether for COVID-19 or numerous other health issues. However, this is unlikely to happen unless each individual within our community works together by following the simple public health guidance, the 3 W's, keeping people home when they're sick. You've heard all of these before, and following the public health orders on isolation and quarantine. Abraham Lincoln said in a different context, "United we stand, divided we fall." However, with our communities fighting against this virus, this point still works and still stands. We can disagree on so many different things, but against a highly transmittable respiratory virus, we need to follow the science and all work together to protect our families, friends, and community. And I hope we'll continue to do so and can unite around this common cause. Thank you.
Thanks, Stacy, Jim, and Doc Holzman. We'll now open up for questions. If you'd like to ask a question, you can press 5*. Be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask a question. If the question that you were going to ask is answered, you can press 5* again, and it'll put your hand down. First question.
Hi, Governor Bullock. This is Maritza Giorgio with NBC Montana, and I have 2 questions for you. The first, I understand Dr. Birx is in Yellowstone County today. I'm wondering if you're meeting or talking with her and if she's offering any kind of new advice to handle our case surge.
So I had encouraged in a conversation probably 3 weeks ago that Dr. Birx directly reach out to county officials and health officials in certain counties. So that it is my understanding that Dr. Birx is in Yellowstone County today, meeting with local officials and local public health. As far as what all she
Okay,
was,
my next...
and Maritza, as far as what all she'll be saying, that I don't know, but I encouraged her to do that directly. So, and I appreciate her taking up my ask.
Okay, thank you so much. And I'm wondering also, after filing for temporary restraining orders against 5 flathead businesses, have you had any kind of response from those businesses, either through cooperation or pushback?
Yeah, I think that there has been at least conversation with one or more of the businesses about actually settling. And to be clear, like, look, the whole idea behind this and the hope is that, and there's hearings set for next week, but the hope is that all these cases are settled, meaning that what these businesses choose to do is follow the directives along the way, and then the legal actions will be able to be dropped. The goal certainly isn't to punish any business. The goal is to keep employees and customers safe and healthy through this pandemic. Next question.
Hey, Governor, this is Holly Michaels. I've got a question I'd like to get your thoughts, and I think Dr. Holtzman's on as well. I'm wondering if you talk about the steps to slow the spread of the virus, and just looking at the case growth daily, it's clear people at this point aren't following those steps in a way that would keep that case growth low. And you said in previous calls you've heard from this wide cross-section across the state compliance with health precautions is lacking. I saw an MTPR report this morning. Most counties haven't taken up the offer to help pay for enforcement of these health mandates. And it's all that's happening. We're seeing this continued opposition from people over things like mask mandates or other precautions, and sometimes even holding events about that end up violating those health precautions. Even county commission meetings like Ravalli County last week. And I'm wondering, given all that, are there ways that you feel like either state government or local government can be doing a better job of reaching out to people who aren't doing what you're asking of them right now and getting that message through? And then also, how the state works to counter messaging that might be spreading false or dangerous information about public health right now?
Sure. Well, there are a number of things. Like, that's one of the reasons why we brought enforcement actions in Flathead County. And again, it's not about punishing. It's actually about getting businesses and others to comply. And what we've seen by and large is that in most counties across our state, most of the businesses and most individuals are taking this seriously. We're trying to make sure that this isn't just, as Dr. Holtzman said, and he can speak after me as well on this, this isn't just about a bunch of government officials saying that this is necessary. That's also the reason that we've had healthcare professionals talking about sort of the challenges that they're starting to face. And I would also say, again, Montana isn't unique. 47 states have had an increase, are seeing increases. I think last Friday was the largest number of cases nationwide that we've seen throughout this. As far as countering the messages as well, that I think, and Dr. Birx was in North Dakota yesterday, and there was a quote that came out from what she had said, right, in North Dakota, which I think is equally applicable to sort of some folks in Montana that don't want to do things like wearing the mask. She said, together, we're deciding not to mitigate against this community spread. We're making a choice to keep North Dakota children out of the schools by deciding that my personal freedom is more important than that child's education, or my personal freedom is more important than caring for a North Dakotan in a long-term care facility. So it's that together choice that we and healthcare providers and so many of our locally elected officials have been saying together. It's the steps that we're going to take as a community to curb the spread of this virus. And again, as I have every time, I encourage Montanans to take these steps seriously, because it is, as Dr. Holtzman said, it's those actions where that's what keeps it from our congregate care facilities. That's what keeps it from our schools. It's those collective actions that we have to take. And I'll turn it over to Doc Olson.
I don't have much more to add on this except to say, you know, everybody keeps saying this is not a political issue, which is extremely correct. But look at what the science is saying. Look at what the Dr. Fauci's are saying, what the CDC is saying, what many academic medical centers and infectious disease providers who understand virus very well, and public health experts who understand the movement of viruses in a community very well. And all of their comments are very similar. They say the exact same things over and over again. And if we would follow those guidelines, we would be in a much better place. The other thing I would say, you know, we often talk about everything happens locally. And another quote people say is don't talk about politics and religion. And that might be true, but I think with your friends and your family, we have to talk about this virus. We have to be telling people around us, you know, can you please put that mask on? It's going to protect, you know, my grandmother. It's going to help protect these things. And so we need to have those frank conversations with the people that we know, so people will start to, we can build that group and that large population that is following the guidance and hopefully controlling this virus. Thanks.
One thing, just one more quick question. I'm wondering, pointing out that this is not just a trajectory Montana's on, that everywhere is struggling, but is there anywhere that's handled this better than other states that you're looking to that Montana might be able to model or see, or maybe try to emulate in some way? Or I'm just wondering if there's examples out there to look to.
As far as other states, Holly?
Yeah, or municipalities, or really, anything that you guys have been able to say, look, they were able to get a curb on growth, or this, this effort or this public health messaging really struck better than what we've seen in Montana. Just, understanding that this is something that most of the country is struggling with, but if there's any bright spots out there.
I think literally that's the challenge, is 47 states are seeing increases in cases. So the challenge really is that, Montana on the one hand isn't unique. Montana is unique in as much as that typically we really care for those in our communities. And no, I do even look at, Lewis and Clark County, as an example, recently put crowd size limitations at 50. Look, we encourage those local governments to be doing the things to actually take those steps, but there's not necessarily any other state that I would look to and say that this is the gold standard of how this should be done. There was quite a while where candidly I was saying, and others were looking at Montana and saying this is the gold standard of how it should be done. But that was not even as much of what I did from this podium. It was how Montanans were responding and taking it seriously along the way. And Montanans, like folks all across the country,